Hello viewers, this is Dr. T V Suresh working as a consultant in Srikara Hospital, Kompally, arthroscopy, arthroplasty and trauma surgeon. Now we are discussing about avascular necrosis of the hip joint. Means it was related to when osteoarthritis of the hip joint also. Okay. So for these patients, usually they will present to us with a complaint of pain in the hip joint. Mostly we'll assess the patient, we'll examine the patient, and just after that we will examine, and after that we will advise an X-ray to be done. So in X-ray usually if at all any changes are there, any mild changes are there, we will not see. Only some advanced changes are there, then only we will see. Okay, so if at all any doubt is there, we will get an MRI to undergo. Okay, so after MRI we will see, we will assess the patient, like what is the stage which he is in. So we will assess up to stage 2A, we will make them to undergo stem cell therapy. So it is called as a core decompression, hip joint core decompression. Okay, so in this one what we will do, the necrotic part or dead bone which is there in that part, we will remove all that part, and we will inject the stem cells which are prepared from our body only. Okay, so after that this will be normal. Say for usually it will be normal for 10 to 15 years, or usually we will see for some patients it will be there for lifelong also. Okay, so after that we will see in some patients it will even undergo like a secondary osteoarthritis changes also. In those conditions the ball will be deranged, and as well as we will see the changes, osteoarthritic changes even in the cup part also. So usually for these patients we will advise total hip replacement, where we will see these conditions usually. So mostly we will see after say rheumatoid arthritis condition. Usually in young patients also it will be affected in rheumatoid arthritis condition, and after say post traumatic conditions, and as well as the fracture neck of femur also we will see this condition, and along with that after a long time medication of steroid uses also we will see this condition. Okay, so so in core decompression what we will do after giving a stem cell therapy, we will usually make the patient to get rest, means bedridden for say 3 to 6 weeks. Okay, so after 6 weeks we will make them to walk. So in advanced arthritis we will do usually a total hip replacement. After total hip replacement, based on the bone strength, we will allow them to weight bear immediately, or after day 1 after surgery we will allow them to make full weight bear and then to walk with a support. Okay, so usually they will recover well and they will walk well, and they will do their daily activities in a very good manner. Thank you.